Welcome to CommunityPharmacyNetwork.com, the Prescription Pulse podcast. One of the hottest issues happens through the years is the issue of the pharmacy benefit managing system or managing organization. Historically started since 1968, I think, a little bit earlier than that. As just as a software company which is processing claims for the pharmacy, and it started getting bigger, and now they control the business for everybody. Uh, the pressure on the pharmacists and the pharmacy organization has been significantly impacted by the practice of those organizations. And the survival mode is here as some of the independent pharmacy and community pharmacy started closing their doors, and some of the chain nowadays being reporting that their reimbursement is being affected too. Uh, Low reimbursement is the topic. I mean, paying less for the medicine, which costs more, because the process of calculating the cost for any business operation is not only the cost of the medicine. And I noticed that just when I look at the claims I sent and the response I get back, all the overhead for the business operation is not even calculated and not considered in that reimbursement. At one point, if the business depending 100% on prescription, and you have a pharmacist professional who's in the back end running the operation of handling the uh, prescription for the patients, following all the rules and the regulation. At the same time, in the community pharmacy, the advantage or the benefit of having somebody really in the community at the time of emergency is important, and it's not just considered as a business booth right there, and should be targeted uh, on their profits or income should be controlled by somebody else. You can't just manage somebody who's really professionally helping the sick people. So reimbursement pressure is all over the place, and it is on the community pharmacist. It is on the chain right now. Also, the most of the time they set that reimbursement to a very low rate, and by the time the pharmacy or the business receive their reimbursement, they check the cost of the operation is higher than what they get. So there's another issue also, the direct and indirect remuneration, the DIR fees, which is really affecting a lot of the pharmacy operation and basically affecting the one who really running a high volume of prescription. That's retroactive fees can unpredictably reduce the pharmacy profits. The preferred pharmacy network is one of the issues. The pharmacy benefit managers started doing their own preferred pharmacy network, and they exclude the community pharmacy from the network, and they limit accordingly. They limit the patient access to their medication when you limit a pharmacy in the neighborhood not taking, say, your your insurance, because the professional who's in the back has nothing to do with the who's carrying the card for the insurance, and those are your clients and those are your patients. Being patient, being sick had never been a choice. I don't know how people they think about it, and I believe the sick person who's really in pain or have asthma or running around, carrying a prescription and getting uncovered item is not fair. Um, we never plan sickness in our life. All the time, people are trying to eat well and work and provide for their family and for themselves and be healthy. But when sickness happen, that's where the role of the insurance is set for to help in this area. Vertical integration happening right now, and that's integration from between wholesalers and the pharmacy benefit management corporation, and all of them at one point, as long as they are corporation, they give themselves the right to be involved in the business in from any window, from any door. So we're seeing right now um, the insurers are owning their own pharmacies, and it's a clear conflict of interest. It's bigger enough, it's very large that nobody can handle it, and the authorities they just close one eyes and they don't want to see it. It started early enough when CVS acquired Caremark, and they became the pharmacy chain, they became the health insurance provider, and they became uh, the doctors too. Now they have clinics inside their operation. So we've seen it in Amazon, the same situation. Yeah, they have the right to have a pharmacy operation, and they do have access to a lot of data for the all the patient across the nation. They have their information because they bought something from them. But that's not necessary. In this case, if somebody can have the clinic, have the pharmacy, have the medicine, all in one place, and the professional pharmacists or the professional doctor, if they are not part of the network, they have been excluded. Yes, they have to adapt to the change. What's coming in the future is a little bit harder than what you think. The technology adoption, it became a must. Robotics are coming. I mean, we see it all over. Luckily enough, the pharmacy is one of the uh, professionals that have been uh, technically ahead of the game, and we since 1995 the robots have been used in the chain stores. And I remember with Rite Aid, I worked with them for some time, and we installed the new Script Pro, and it helped a lot. It made a big difference in the pharmacy operation. Now it became a mandatory. It became a necessity, actually, if the volume is more than 400 or 500 prescription a day, the robot should be involved in this. Shifting the business model is important. So it's part of the survival change, as survival mood, I say, because adapting the change is a must at one point along the journey of the business operation. Uh, we're gonna see some new models of pharmacy coming in. We see specialty pharmacy started coming up. We see the independent operation started changing a little bit. Some of them are doing the delivery completely from one curb to another. Some of them are really focusing on certain communities. The advocacy effort facing the challenges with the pharmacy benefit managers is an ongoing uh, process, and some organizations are pushing for reform and transparency. Very strange. And the word transparency, when it comes to the healthcare system, it should be the norm. It's not like something the corporation should take advantage of it. This is I believe, business ethics. So just started taking the hot topics at this time in the podcast. And I believe that my voice can make a difference. If just at the level of myself, my word is out there, and I believe there's so many pharmacists out there. They have the same challenge. They think the same way. It looks like without communication, nothing could be done, and the message could be sent to the authorities or the people who knows. But increasing the level of awareness about what facing the profession is very important, and this is one of the major advantages or benefits. I think this kind of podcast will help on bringing the awareness of the patient, the doctors, the pharmacists to the level where they know that they have a challenge and they're facing a future which is really unpredictable.